Thank you very much, Madam Chair. Dear Alejandra, I must emphasize that throughout this COVID crisis, which I think serves as an example in many different ways, our three committees all worked very closely together. We had meetings of the joint chairs under the leadership of the Secretariat, and to me it's very important to say this was an opportunity for cooperation between the different committees, which was quite exemplary. And since Peter Paul didn't do so, but perhaps he could come back to it when questions are asked, I also wanted to say that the cooperation between the two committees are illustrated not just in terms of these emergency matters, but also on November 18th, we'll have the World Day for Philosophy, and the Secretariat UNESCO is very involved in this. Peter Paul is one of the main promoters of this, and I would ask everyone to note this in their date book. This coming November 18th, World Philosophy Day. And now if we could have a look at the next slide. This fourth statement. Next slide, please. So here you see the central issue. Leaving no one behind. And having an ethical way of dealing with this dramatic situation. This has mobilized us all and has done for almost 2 years now. Next slide, please. Next slide. You reminded us, Madam Chair, that we have on February 24th this year, all of us together with support at the highest level from UNESCO and the WHO, supported this declaration on access to vaccines. And now our fourth statement will still be a part of equitable vaccine access, how to guarantee equal access to everyone. Obviously to certain therapeutic products which may be developed to fight COVID, but particularly to the most effective vaccines. We had already indicated in our earlier statement that we must make anti-COVID vaccines a world public good. Let me remind you of the definition of this. A good from which no one can be excluded and whose use may not exclude anyone. And so what we see is that in the very short term, we're going to have to produce more, extend and develop existing production facilities, build new ones, and build them as close as possible to the populations who are in need of them. In the longer term, there will have to be a skills transfer to produce those vaccines, and we'll come back to that in the case of other vaccines as well. Next slide. So we have to begin by falling back on existing initiatives, such as, for instance, the COVAX initiative. But what we see already today is that the fact that developed countries are recommending a third dose of vaccine for the population over 65, because of insufficient production, the COVAX initiative is no longer receiving sufficient amounts of doses and will not hit the 20% level promised by the end of the year. We see, on the other hand, that there is excess supply in some countries, especially for certain vaccines, which are not being accepted by local populations. We consider that the ranking that was created by WHO to recognize vulnerable people, or people who should be considered as being on the front lines, particularly medical personnel, applies to all countries in the world on an equal footing. And this equitable distribution needs to happen throughout the world. And we therefore call for a start to revise policies which are giving favorable treatment to some populations, like young people, that don't need them as much as people on the front lines. It has appeared in the last months that one of the obstacles to the distribution of the vaccine was the issue of intellectual property. And 100 or so countries went to the WTA and requested a lifting of the trade barriers that have been established by intellectual property so as to be able to produce more in different countries throughout the world. We also request a temporary suspension of intellectual property rights on anti-COVID vaccines. We consider that it is necessary to apply exceptional measures in an exceptional context. Next slide. Lifting intellectual property is not enough. We also need to produce. And producing isn't enough. There is also the issue that is also often summed up as the problem of the last kilometer. There are problems of logistics and distribution. So we need a global approach. We need to produce more and better distribute. And in order to do this, in many countries, we'll have to set up legal instruments and solid institutions which are able to make these legal instruments respected. We are not going to turn our face away. There is corruption and there is nepotism, which are also obstacles to the production and distribution of vaccines. Next slide. So we need to make production come closer to the places where it would be useful and where it would be distributed. This is an ethical commitment, but it's also a scientific commitment. And furthermore, a commitment to inclusiveness from all groups, including scientists and local professionals. It is absolutely necessary if we want, as Peter Paul just reminded us, if we want to have a sustainable effort made, that the infrastructures that are set up, the technology that is transferred, which will be advanced technology, be maintained and managed by health professionals and drug production professionals who are competent. And so there's a whole transfer of knowledge which has to happen.
And this transfer of knowledge will be the best guarantee to protect us against future healthcare challenges, because we know that we will be confronted with COVID-19 for a long time. Only 3% of the population in Africa has been vaccinated. New variants will appear on the horizon, and we know full well that there will be future viruses as well, and we need to be prepared for that. Next slide, please. So we are making a clear appeal, and we renew this solemn appeal, that COVID-19 vaccines should be turned into an international public good that is not exclusive and is not subject to competition. We call on all countries, and especially countries where the vaccine is produced, that they take on board their responsibilities. I mean, it's a very heavy responsibility. We're talking about 15 million deaths around the world to bring the world's population out of this COVID-19 pandemic. It is a real aberration to hear decision makers talk about delivering vaccines in the second half of 2022 or in 2023. We have to act now, because COVID is bringing countries' economies to their knees, but is also undermining citizens' faith in the progress of science and technology. Thank you for your attention.